Yeah, so hope here we have become friends, and he's trusted that I can help him, and we prayed together and sought the presence of the Lord, the blessings of the healing in his life. We've talked about his troubles, we've discussed God, and you've given him or her, if she's a female physician, the assurance of God in his life. And then I tell you, we are going to handle respiratory diseases, problems that begin from here and up to this. Maybe lung problems or bronchial problems, or it may be the problem with the trachea. Hope here may be having asthma. So I tell him that we are going to do hot foot, but you must tell him what he is going to experience. We are going to use the hot, we are going to use, in this treatment, we are going to use towel, and this towel needs to be very heavy towel. This is just for demonstration. One we are going to put in cold water, and another one we are going to put in hot water. This is hot water. So sometimes it may be too hot for your body, but you will tell me when it is too hot that you cannot bear, so that you don't burn the what? The patient. Are we together? And you can see that when it is too hot, you will see in the facial expression of the patient. Now the hot, we put the hot towel in hot water. This is cold. This is the hot water. The hot one, because you have you have the asthma and your bronchioles are, the air passages are blocked as a result of mucus. So we want to dilate the cells so that they easen out the mucus. They allow the mucus to get out of the body. Or if there is any inflammation in the blood vessels within the bronchioles of the trachea, it opens up so that blood can come and remove the toxin. Are we together? Yeah. And then the cold water, we are going to apply cold towel, water towel from cold water. It helps to constrict the cell so that they are able to push the water, the toxins. So when we do when we alternate hot and cold, hot and cold, hot and cold, there is opening and closing, opening up and closing. With that, if we do it effectively, it will be able to expel the toxins. Remember our laws, our principles in eliminating disease, that nature is to be assisted to expel what? Impurities, and then reestablish the right condition in the system. So we are going to put the hot towel, the towel in hot water. We're going to put it, we are going to put on the chest for 3 minutes, and then change to a cold one. When we remove this, we put cold one immediately for 1 minute, like that, until we receive the desired strength. So the percolator can come this side. I don't know if we will be able to use here. So I hope you're going to step up and you will lie. Another thing before some if you are doing this treatment, make sure you add everything. Are we together? You will have the things you need are, you need to have 3 towels, 3 heavy towels. And then you need to have a bucket. You need to have 2 buckets, one for hot water, one for cold water. Are we together? Are you hearing me? Are you getting me? Yeah. And then you need to have maybe a blanket or, yes, a blanket or a sheet. And then the person, there can be a pillow where the person needs to rest. So you are going to get up, yeah, just and sleep with your back. Okay. Okay, so and then you be like that. And then the next thing you want to do, because we want the patient to be as warm as possible and comfortable, you want to have a blanket or a bed sheet to maintain the temperature so that some parts do not have cold or get cold and other parts are hot, because if the leaves are cold, what? What are we thinking? Can I say respiratory diseases? Respiratory diseases or heart problem, diseases that are from this region. So this is just a demonstration with the respiratory diseases, but this you can do in many parts of the home. I'll show us that. So make sure that it's covered well in a warm environment. Don't leave the limbs open because cold will get through the leg, and if it gets here, it can affect the whole body. Then the next thing you're going to do, another thing you need to have is this polythene. Have a polythene with you. It is something that is going to help me aid. Then I said that towel should be very thick. They're very heavy towel, and the color should be white. Always when you're doing this treatment, buy white what? Towels, heavy towels, heavy cotton towels. And then I'm going to have they should be long about 3 feet. About 3 feet. They should be long enough because I want, if I put it here, this side edges can hang where? Outside. So let's assume this is the towel that we have. So I will fold it in the middle until you receive or you have a desired length that you can hold. So I can do it like this, and then you put it there. At the same time, get ready your towel, another towel in cold water. It should be ice cold water. If you have a fridge, you can put it in the fridge, in the freezer. It should be very cold. If you don't have that freezer, just put it and you can put very cold water. How it will. Yeah. Everything should be set at your facility. Are you seeing this angle? Everything, I can access them very fast. Another thing you need to tell your patient before you begin the treatment, is he hydrated? So you need to drink some water in 30 minutes before. You ask him, when did you drink water last? If it was 2 days ago, that patient has to drink 1 liter of water and he waits for about 1 hour for the treatment to be effective. So make sure your patient is hydrated. So you take your hot water we've just begun, and your eating sauce should always be there, because this water I'll require it to be there constantly. I think someone will have to get me maybe a jerrycan, a clean jerrycan with water, so that I can be able to change very quickly. So I will pour the hot water. I will pour the hot water. But if this thing was very long, I will just put it and pour water there. It is better to use a pen because the pen will contain the heat for a long time. If you use the basin, it will lose the heat very fast. Are we together? Yeah, the water will lose the heat very fast. Then you want to ring, hold them up here. Don't dip everything in hot water. It will be difficult for you to remove it. And then you ring it. You ring it, you ring it up, you ring it up until you remove every water. You be very careful what to burn. And then I will remove this. And most of the times you do it when the patient is has removed this side. The short side, if it is so hard, you do it like this: 1, 2, and then apply. Are you seeing that? Okay, and then immediately you cover. You cover with a polythene so that the heat cannot go out very far. Are you getting it? And most of the times, we can do this. Can you just sit? I can do something like that. I can do something like this. Can you now see? Yeah, and then I put it there. It should be in the region that has the problem. In this case, the chest. You cover from here to here. And then make sure it is stuck in there well. And then bring your polythene, put it there, and then put this one up. You see now? The heat will not get up very far. Then the patient should stay for 3 minutes. If I was using very hot towels, I will do it for 5 minutes. So this is right. So if you stay here for 3 minutes, the hot one, 3 minutes. And then after the 30 minutes, I bring the cold one, very cold, ice cream. Or after the 5 minutes, and then you remove this one, so you remove this one, and then you remove like that, very far. Not even 2 seconds lost. And then you can do that like that. Bring this one back here. All right? Like that. There's no need to cover with this a cold one because there's no heat loss. And then immediately 3 minutes are done. Come back with your hot one, then apply it immediately. And then you are this one here, and then cover with the blanket. Now, that is another thing you can do. You can do it on a bare speed, but you have to listen to your patient. At the beginning, you will find the patient is sensitive because there's nothing, the heat has not got directly on it. It will be very hot. You may sense that. But as time goes by, and you need to regulate, you need to know the heat or the temperature that is of the body. If the water is at 43 or maybe 45, 43, 45, that is maybe too hot for your patient. So if it is too hot, by the first time you must know your patient. The skin may be very sensitive, so you may not need it to be very hot. Are we together? You must know the patient you're working with. Some people's skin are so thick that even if you put the heavy one, they don't sense something. But with that, you have to be very careful, not to burn the water. So sometimes, if the body has gotten used to it, I can put a thin towel, a thin sheet like this here, or it can be on the skin direct. But making sure that it doesn't burn the body immediately. Now, when you do it seriously, you yourself, you will be sweating. Seriously sweating. The patient will be sweating on the neck, on the nose, another coil. If the sweating is too much, you put a cold towel here. Are we together? Yeah, cold towel. If you in cold water, it puts you. And sometimes you can help your patient to wipe the sweat, even if it's. So you keep doing it. If someone is seriously sick, you need to do it about 6 rounds. 6 rounds of hot and cold. With hot and cold. No, the head you don't cover. You don't cover the head. The heat that is here may not be too much. The heat here will be, that's why you will be sweating. Hello. Yes, Professor.
No, that is what I just wanted to alert them why the forehead should be covered.
Yeah.
There's electricity that regulates how the brain works. If it goes beyond a certain extension or bridge, actually the brain doesn't function. And he will start having convulsions.
Yeah. When do we put the wall or when do we do this treatment? The treatment. The treatment we do for all chest complications. All chest complications. When a patient has gotten. Now, when a patient has gotten a heart attack, you don't do this. There are first aid treatments you have to do to stop the flow of blood. Because if you do this, the blood is going to the cells are going to burst. So what you do is to stop the bursting of this of the artery. So there are specific treatments you can do, like putting cayenne under the tongue to stop the bursting of the blood, or a tincture of blood to stop the bursting of the arteries. Now, there's another way you can advance it. There's another way you can advance it. Can you yes? Yeah. We want medical missionaries who are very efficient. Are we together? So I put this in hot water. This is another towel. In hot water, I have wrung it up. And then I put it, assume the boy was having a problem with the heart, with the lung, having asthma or bronchitis, difficulty in breathing. I'll put this one here. It is very hot. And then I try if you can, if it is so hot, okay, let us try again. Okay, it is still hot, standing hot, and then how do you feel it? It is nice. Okay, then immediately you put a hot one here, and then cover everything. This is now you want to achieve result very fast. You are not joking with the disease, because if you joke around, it is going to overcome. So this one is eating the first five cervical discs, and the heat gets from up, from down and up. So you find you achieve you get a very effective way of dealing with the problem. The vessels from the disc that connects to the heart, to the liver, and to the kidney, and not to the kidney, to the heart, to the lungs, and all the respiratory organs. Every organ around this place is stimulated to remove toxin. Are we together? Yeah. Then 6 rounds. If you can manage 10, do the 10 rounds, but you need to hear from your patient. Are you feeling lightheaded? If the patient tells you, oh, I'm feeling like my head is rotating, then it's your time to stop. But that is not the factor to determine that you need to stop when the patient is. These are just some of the indications, contraindications that you will have, or some of the effects of the treatment you are doing. People are different. So do the 6th round at least, and then you need to end with deeper cold, a towel in a tepid water, slightly lower than warm, and then do what? grab the what? The chair. And then immediately stands up, remove this cloth, or he can go to the bathroom and pour tepid water on himself. Tepid water is like not lightly below warm. Yeah, and then let him know to stop. And then he will, after that, you need to cover him very fast so that the coldness will not get into the body. You need to go and rest somewhere. You will, or usually after this treatment, the patient will feel like going to sleep. So he goes to sleep, and then he may take a cup of warm water and then go to sleep. Are you getting me?
Let me assume I'm a doctor here, professional doctor. Can you tell me why you have to wipe him in cold towel after doing that?
Let us see. The last one is the hot one. Yeah.
The reason why we must wipe him with a cold towel. The end towel that we use was hot and the body temperature raised. Therefore, in order to make his body temperature in the middle sense or to lower it, we must use the collar towel so that he cannot have high blood temperature.
Yeah, we are trying to normalize.
Yes. Why are we having collar towel on that?
That is the thing. You have opened up all his skin and the pores are open. He is susceptible to any airborne disease or any disease that is around. And so that is why we do that very quick. Yes. Try to ask these small details because we will be standing before doctors and they want to disqualify what you are doing. They just trap you with something small. Why are you doing what you are doing? And you don't have an idea. You just scramble, you wipe with the cold water. Trouble begins.
I have a question. We can use two towels, one from the back and one here. The first time we were using one towel which is hot, you put replace one and then cold. Now if we have to put this one behind which is hot and the other one hot again in the chest, how are we going to normalize the temperature? See, if you are to
to make sure that and we're doing 6:30. So it means roughly 30 minutes. Now the days depend with what you are seeing, the results you see. You can do it every day for a sick person. The result, how many days, depends on what you're achieving here. Are we together? But usually, if you do it 3 days, the patient should be having a lot of changes. And now, if someone have a problem, you put, it is better you just put the towel that covers from here to this side, though the heart is this side. Are we together? Yeah. Everything in the heart, if the lung, the left lung is affected, we do it just for your safety. Just do for the whole heart. Just do for the whole chest. It will affect every organ here. And you know, those organs are almost close to one another. If one is injured, if one is affected, it can affect the other one. You know that? If you have a problem with your left lung, it will affect your heart, and you can have COPD, chronic obstructive pulmonary disease. So Any toxin in another organ can be infused to another organ, diffused to another organ, because the cells are slightly close to one another. So you want to remove any toxin around here. If it is if it is let's say the person has a problem with the spleen. Where do we have the spleen? Where is the spleen? Can you touch your spleen? Hey, can all of us stand up? Stand up, please. We are learning. Stand up. Where is your spleen? If you want to touch your spleen, I want to see. Where do you find your spleen? No one knows. Now, can you on your left side? On your left side, do this. On your left side, we know that we have the last two ribs are hanging. If you start from here and you go like this, you count from down one, the last rib down one, and then two, and there in the middle, just above the two, the second one there, your spleen is beginning from there, and it goes roughly about 2 inches down. Yeah, so calculate this angle here before it gets into the spinal cord and this region here. So there is where you put the hot towel and the cord, you do the fermentation. What about if it is the liver? Where will you do the hot and cold fermentation? Yeah, the liver. Where? Let me see. You should be touching any part if you don't know, so that you can be corrected. Where is your liver? On the right. Where specifically? Your liver begins from. Are you seeing where your rib, the downner rib, almost touching the spinal from this side? You see this place here? This is the rib connecting to this side, and then beginning from there, coming, before you reach your nipple, goes up to 2 inches. 2 inches is 1, 2. Those spaces there. Before you reach your sternum is this thing here, right? Yeah. So that region coming up to this part is where your liver is, your gallbladder and pancreas. So if someone is having a problem with the pancreas, with the liver or gallbladder, you put it from this region coming up to the part where your rib is being what? Is connecting with your, almost connecting with the spinal cord. Are we together? So you can sit down. That is your teacher. You do the hot and cold. Now it will be somewhere here for the liver. There is no harm in using a towel that covers everything, right? Yeah. So you do hot and cold, hot and cold, hot and cold. If it was inflamed, you will see it reducing. There's nothing like the effective of this for treating this localized inflammation. And now, what about if it was the colon that is having a problem? You put it here on the abdominal region. You do it in this region. Slightly lower. Okay. And then also, if someone was having colorectal cancer, and I want to stimulate blood to go into those cells and remove the toxin, I will put it here. Autumn 4. All right? Yeah. If it is the kidney, can you sleep with your belly? If it is the kidneys are this place here. Then you put the towel here. Hot and cold. Hot and cold. Any problem, if it is a woman having fibroids, having cervical cancer, you want to put the hot and cold here. You do it here, and you change the abdominal region, the same. If the person is having prostate cancer or prostatitis, inflammation of the prostate gland, you do it there. Following the procedure as I say. What about if it was the leg that was swollen? Let's say someone has varicose veins. So I do it in the leg region. I can put another one down, another one up. So the one in the top is the way what I change, pouch and pull, pouch and pull, pouch and push, like that until the person begin achieving the immune system. I believe we understand that. Right, so that helps us with any inflammation in any place, pouch and pull in that place. If it is the high, we can use very warm water. If you have an inflamed eye, you can use warm water. You just give in very warm water. You cannot use very hot water or a very hot towel in your hand. It should be slightly warm. If you have a thermometer about 36, 35 degrees centigrade, then you put it in the eye for 5 minutes or 3 minutes. You remove, you put a cold one like that for any eye inflammation. Are we together? And then we have another treatment called eating compress. Eating compress is where you use a towel, you dip it in cold water, dip it in cold water, and then if the person was having a problem with the sore throat or and flu, you come and put it on the. Don't see it, just. Yeah.
If he has received enough treatment, he needs to sleep.
And then you can wrap outside with a dry towel or a scarf. You can put a scarf. And then when the first is going to be in peace. Yeah, not the sleeping and false relaxation, right? So what this is a very cold towel. What does it do? You know, the body is very sensitive. It will sense that there is some coldness somewhere. What is the brain telling the blood vessel to do? To bring heat, to heat it up. So as it is heated up, it brings a lot of blood to the surface and they remove the toxin. You just do that once like that. In the morning, you will find when it is warm. If you have sore throat, you have cough, you have flu, you have a disturbing throat, any inflammation in this area, you have thyroid problem, that's something you can use. Yes? Yeah. Tonsillitis, you say. Yeah. You can see that again. Then there is another treatment we can still do. Now this is called mitten friction. Called mitten friction. Just from the name, called mitten and friction. For you to achieve friction, what do? You rub, right? So you dip this in a very cold water. If you have ice water, dip in very cold water. And then you come to the skin and rub. Rub very well. And the towel should be not a smooth one. If you have the cotton ones, like the face towel made of cotton, it will do you great job. So you have for the we begin with the extremities. Begin from the hands, begin from the extremities. These are principles you have to follow from the extremities, the hand. You rub very well towards the heart. Towards the very fast. You be very sweet. A medical missionary is not someone who's sick. And then this side, very fast, very fast, very fast. This is to stimulate blood flow, the whole body, the whole body. Yes, and then the legs. Okay. The legs, you may begin from the legs when the person is sleeping, and then you go to the hands when he's seated up like this, and then you begin the chest and the stomach, and then you end the back. And then the person should now sleep and you can cover even the rest. This friction brings blood to the surface and it opens the pores. And so toxins can be eliminated. Nature should be assisted to do what? What should nature be assisted to do? Expel impurities. Now, there is another treatment we can do. No, I've really tackled a lot of them. Okay. I don't want to overload you. Let me see another one here I can demonstrate to you very fast. This, I want to finish cold sheet treatment. For cold sheet treatment, you dip this sheet in cold water, very cold water. Very cold water. Prepare the patient, then this thing is going to be very cold. So, after dipping in the cold water, can we just pull it down, please? I've dipped it in very cold water, and then the patient comes. I want to wrap it. Once wrapping with a full towel, okay. If you're strong enough, you can carry him.
Yeah.
But what of if it is like my brother? I cannot carry him. So the next thing you do is put in a very cold water, very cold, and then you put it on the bed. You forward. Okay, sleep with your body. And then you cover everything. Cover and truly tight. There should be
No cold escaping.
don't think these are Muslims who are going to be bad. Please. Someone increase it. And only the air is left. And then you should have a blanket. You first put a blanket, a very heavy blanket down, and then you follow the blanket with a sheet like this one on top of the blanket, and then you put the cold one on top. So I will begin with the towel. I cover with the towel. This is dry one. This is not put in any water. And then I finish with a blanket. It should be a blanket, heavy blanket. Then that person should now sleep. The person will sleep. The very first hours, you may experience a lot of cold. Let's say we cannot sleep. But later on, he will begin to sleep. This one is we call it a treatment for the incurable. It stimulates the whole body. It starts the circulation because the towel is very cold and it is airtight. Blood will flow to the surface and bring toxin. And you may experience after doing this, you may see some skin problems or rashes coming. It means the toxin can be eliminated. Yes. Okay. For the cold mitten, I will not use it for now. I just want the cold, everything to be at that temperature. The body will heat it itself. The reason why I'm putting the blanket, a sheet that is dry and a heavy blanket is also that there is no coldness from outside. Are you getting me? Yeah. Okay. So there is also another treatment you can do for it is called the fever bug. Yes. No, this I say overnight. If it is daytime, at least 3 hours. If it is daytime. So the next one I want to do, I don't know how many minutes I'm remaining with.
16.
16 minutes. 16 minutes now I want to let the patient get out. But we don't have patients, we have health guests. We have what? Health guests. That is, some people are not happy with their.
This guy wants to wake up.
It's
It's not how help is.
Stigmatization, no? Can we just sit down? And then, we want to do, we want to do a treatment called hot football. And for the hot football, we are going to use a peg. You must have a bucket. We call it a bucket. Having a bucket, and then we must have that towel in your hand. Yes. You must have a towel. Small on this side is good with you. And then you must have a source of water. I don't know if it's boiling.
Do you really want to illustrate or what?
Yes.
You want to use the hot water? Just
No,
illustrate.
Yes. Have a what? And then you need to have another bucket with the cold. I think what I'm doing. And then you need to have a bed sheet, a blanket. It should be a heavy blanket. And then you need to have this. A polythene. It should be a big polythene, maybe for a mattress of 4 by 6 or 3 by 6. So your patient can come with that. This is cold water. The bucket is cold water. And you have hot water. It should be water ready with 42 degrees Celsius. Slightly above the body temperature. If you have a thermometer, let it be from 28 to 40, depending on how the patient is respond. Now with this also, you have some contraindication. If there's something, you may not do it for someone with low blood pressure, or even someone with high blood pressure. You may not begin doing that for him. And then you may not do it for a diabetic patient whose limbs are benign. You know, we have met patients that they have gone to the field, but they came back without sleeper, but they never knew. Yes, because these places, the food is it's not sensitive, it's benign. So you have to be cautious because you will not know whether the water is very hot for them or not. So you end up burning the skin. You have a diabetic patient, you get a swell, you may develop a wound that will be difficult. So for diabetic who are having numb feet, you have to avoid that for some time. But the diabetic patient who still have sensitivities, the food is still sensitive. But now when you are doing it, there are key things you need to look at. Also another depending on how she is, but be very careful and expected. Anemic patients, you don't want to do it to them when they have low blood. They may go on a form consciousness. Now, if you want to test whether the water is getting hot, we don't start like this. Because you know, most of the time we call the gender and our answer, which we shower. So you use here the elbow, you put and see if it is too hot, you just. If it burns you, then you know it's too hot. So with that in mind, and you have established, you know the temperature here, you talk to your patient, you tell him you will be here for 30 minutes, at least 30 minutes, of which you can still begin if you see your patient is being troubled, it is better you remove the first time. The second time you increase hours like that until the time when you can even go for so I tell my patient to my helpless to stand up and make them up. So this level. And stand up and put your feet in the water. So I want to cover him like this and then tell him to sit. I want you to be as effective as possible. And then you cover. You cover everything. There is why some people may do it around the chair, but a lot of things will be lost. So you want the things to be considered. Okay. Then you can spray. I use this. A 4x6 polythene, and because one graphic I can cover. So you cover it until the bucket. You may go a whole day. Move like his hand is in there. With that, I tell you the person will do this because it is going on. This particular. There are some hydrotherapy football kits that are made. You just put it on this. It's like made of how do you call this material for those tested? Cancer. Yeah, which material are they made of? Made of. It's the name of the whichever. So you cover everything. You may be all you keep checking the temperature down. If it goes low, you add more hot water. And at the same time, you put a cold towel on the water. Yeah. And then another thing, you bring warm water and you keep giving it warm water with a person because you will be sweating and losing a lot of water that it may fade or may become unconscious. So if you want to be digital enough, you can put a screw here and you give it checks. Because some people are calling, you pour the water in my nose. You don't want such thing. So it goes by himself. You can enhance this by putting garlic or putting lemon or putting cayenne to start circulation. Are we together? Circulation or lemongrass. The lemon to start circulation. You want the circulation of blood to be started so that blood circulates from down to up, and it removes a lot of impurities. Now, once your patient is done here, after 30 minutes, and for children also, you have to be very careful. You begin from the lowest, assume the children and pain. So, after the 30th minute, he gets out. And you have cold water here. He dipped his leg in cold water for about 1 minute. Why do we do that? To normalize, to balance the water. To balance the pressure and the temperature. And then after removing it, line it up, he puts on his sandals, sandals, and then he goes to the bathroom, then he pours tepid water. Tepid water without soap. There's no time to bathe. Little soap. Tepid water, and then he can dry himself with a towel and let him go sleep. Let him not do that and go to walk outside. We are trying to speak of prophecy that after taking bath, what should we do? We should have at least some 30 minutes so that the healing can take place in the body. This thing is very effective and very effective for all diseases. It starts circulation. For malaria, you want to do it 3 times a day. 3 times. For malaria, to start a circulation so that the blood can be stimulated and put to forward. Now, another one we have is cold spray. Duration, I think 30 minutes, it depends on the person. Some may not go even about. And then sometimes we like some they will put this thing so much that you can move there. And you are able to begin to when the patient is feeling dizzy, give him some motion. But if it's the first time of the patient, the person is having that patient, you have to give. Yes. The glasses of water. If the patient did not drink water before the beginning of it, then you need to give once it is 30 minutes. If it is about 30 minutes, 2 like that. Yeah. But if the patient can manage 2 or 3 glasses for 10 minutes to give water, it will not be so good because the stomach will be feeling good. Just give 1 the first 30 minutes. But before you begin, then the patient is there. Now, the next one we are going to do is cold spray. Cold spray. So you have a spray. How many knows a spray? Do you know spray? Yeah, they want to spray cows and honey. Yeah. Yeah, that it can be a 20 liter or 5 liter one. So you fill cold water, ice cold water there. And then the person, you need to do it in a very private place. Then the person comes like this, and then cold water. What do you think the person will? I know many of you here are getting before. The first time you get, well, just calculating, put very fast. Some people will desire to put the sponge with over and wrap and like yeah. So that action of doing like this, there's sensitivity, there's something that has been so one people like on the spinal cord, on the spine, because the spine is very thin. And in the spine, it has all the blood vessels connected to the organs for the lungs, for the heart, for the kidney, and for the liver, for the spleen, like that for the intestine, the kidney, the uterus, the reproductive system. So you do it like that for about 10 minutes. 10 minutes. The person can take and then do it the whole body. All the water. Very good for those who are having mental problems. That circulation, blood moves very fast. If there was a blockade in any organ, it will remove it. And then it opens, it makes the blood, the nerves to be activated so that they can take in more information. So that is very good, and I believe that you are not about you. Yeah, for many diseases we can use water. So there are some others. How many minutes am I remaining? It is done. It is done. Okay.
2 minutes.
2 minutes. The other one. No, now after doing it, for 10 minutes, you can just dry the surface and then let the person go sleep. Now, for those 2 minutes, I want just to finish it up. I want to do steam inhalation.
Yeah.
For steam inhalation, you want to get a bucket, then you do this one here. For steam inhalation, also for the respiratory diseases, asthma, bronchitis, whichever those respiratory diseases, you put very hot water. It should be having steam. Immediately it boils up, I put hot water there, and then you can have your onion or garlic if you don't have this, or eucalyptus leaves, or cypress leaves, or pine leaves, or lemongrass leaves, whichever you have. And then you put menthol crystal, I put it there. And then I have my eucalyptus oil, I put it there. Then I have my peppermint oil, I put it there. It should be, the steam should be so much. So my person having a reflect or a blue or a cross, can you hold it? So you hold it and you can bring a towel, you bring a towel, and then you cover it. Then you want to cover it. One, see what you steam.
Don't burn.
So it should. So, what? What about should be hot, should be having steam coming up. So there's no, I just want the air, the steam not to go away. So even if the steam will be coming up, cannot go down. So you just cover just slightly. And the patient will be there for about 5 to 10 minutes, depending on how that person can. And this oil will be going into the respiratory system. And sometimes we use the kettles. The kettles, and then you put your eucalyptus or whichever garlic onion there, and just breathe it in and out, in and out, in and out, until you feel your chest.
Put it one. Take the bottle. Take.
Yeah. So you can try it over there, or then try and finish. No, finish now. Yeah, and still watch. So anyone who is having serious problem time. Yes. Very much.
Some of the elements added inside.
The peppermint, essential oil, eucalyptus, essential oil, and menthol crystals. If you don't have that, you use the leaves of eucalyptus, the white eucalyptus, or lemongrass, or even rosemary, or garlic and onion. It kills the bacteria in the respiratory system. What was the question? Okay. All right. So I think we are done. And can we humble ourselves for a prayer?
Yes.
Our loving Father, what in heaven, we thank you for your grace. We thank you for your love. We thank you for your providence for us to learn these things. They may look simple, Lord, but they are mighty in dealing with disease. Lord, we pray that with the simple agencies of nature that you've given unto us, we may do a great work for you. May you energize the young men and the young women, the families that are going to take the task of medical missionary, who will be walking from homes to home to help those who are sick. We pray that you gain faith in our lives and you may bring your blessings to us. For this time we pray in Jesus' name. Amen.